I'll ask you this. What about the role that fentanyl plays in the amount of overdoses that we're seeing as well? Because, we now know that, the drugs that people think that they're taking might not actually be the drug that they're giving themselves.
Well, that is true. And, one of the things on the addiction is a very difficult issue. Um, Many people deny that they have the problem. They don't want to admit that they have an issue. Getting the person to accept the fact that they might have a problem is a huge, huge challenge. And any of us that have ever been involved directly with people that suffer from any kind of an addiction, even if the services were there, getting people to take advantage of them is a long-term process. It's not easy. There is this, as Jeff just mentioned, there is this phenomenal denial issue where people, will try to fix themselves, deal with it themselves, and so it's not like having a bad shoulder where you have or you have an injury. You can come in and it can get solved relatively quickly. When you're dealing with behavioral health issues and other addiction issues, this is a long process. So this is going to go on for a period of time, and it requires a massive concerted effort by all of us working together, including public education. And the other thing is that we've always, the way we're organized and have traditionally been organized with regard to the delivery of services like this, they have been organized in silos. You have mental health over here, and you've got medical care over here, and you got addiction in another category. And we got to be bringing it all together in a much more holistic way. And that requires also much more flexibility with regard to the regulatory agencies so that we can all actually work together. And it does require a major, major influx of new reimbursement and new money. And whatever money is coming in at the moment is not going to be enough to deal with the level of the crisis that we have. And for those of us involved in mental health in a major, major way, it's a real challenge financially to be able to provide all of the services you need because of the restrictions on the reimbursement. And that goes from government to the private payers and the private insurance companies, et cetera. So it requires, since we're in the so-called new normal, it requires a new way of thinking now. And I'm hoping that as we all reimagine our organizations coming out of COVID, we have to be thinking very, very differently, that we take a whole new holistic look at how it is we organize the delivery of services around these areas, which means that we all have to work a lot closer together, consolidate some of the functions that we're providing so that we can maximize the utility of all of us.